What is up, guys? Today we are going to discuss the most commonly diagnosed cancer in men. Yes, you guessed it, prostate cancer. About 220,000 new cases of prostate cancer are diagnosed each year within the United States, with about 30,000 men dying annually from it. Remember, at the end of the day, the prostate is just one big gland. In fact, it's about 30 to 50 tubuloacinar glands combined into one big organ. These glands function to secrete a fluid called prostatic fluid. Now, this fluid is secreted directly into the urethra and into the ejaculate and helps support and nourish sperm. Let's review some anatomy for a little bit. Remember, the prostate, this is our prostate gland right here, and it sits right below the bladder. Urine from the bladder drips right down through the prostatic urethra, runs right through the prostate into the penile urethra, and is excreted when we urinate. Now, if we understand that the prostate is basically just made up of glands, then it's easy to understand that if these glands start to proliferate in an uncontrolled manner, that we can get cancer. Exactly what causes prostate cancer isn't very clear, but we do know that it's a combination of both genetic and environmental factors. For instance, diets that are high in fats have at least been partially implicated in the pathogenesis of prostate cancer, and many hypothesize that this is why we have increased incidence of prostate cancer here in America because of our diet. Much more interesting is the relationship that hormones have with prostate cancer. You see, androgens, these are masculinizing hormones like testosterone, have been implicated in over 50% of prostate cancers. It appears that prostate cancer cells depend on, and at least partially rely on, the presence of androgens in order to drive their growth. We start with normal prostate tissue. Note the nice, uniform, neat arrangement of all the glandular cells, which then progresses to a precancerous lesion. We call this prostatic intraepithelial neoplasia. Note the increased proliferation of the glandular cells. And then down here, we see full-blown localized prostatic adenocarcinoma. Note here how we see a very disorganized proliferation of all these glandular cells that eventually just break through the basement membrane and invade the surrounding tissue. Eventually, this invasion is going to cause problems. Remember, the urethra runs right through the prostate, and growth of the prostate cancer can cause problems with urination and eventually progress to kidney damage. Prostate cancer can also metastasize to lymph nodes, bone, lungs, and even the liver. If left untreated, widespread tumor dissemination will eventually lead to pneumonia, sepsis, and death. There's more, but I'm out of time.